911, where is your emergency?
Just as emergency responders are ready to help when you dial 911, there will also be people ready to help someone in a mental health crisis with another 3-digit number, 988, starting July 16th.
I think that in a time of crisis, no one really remembers a 10-digit number, that's out there for help.
Wisconsin has had a suicide and crisis lifeline in place since 2005, so the service itself isn't new, just the number that will connect you to it. The legislation to create it was written by Wisconsin Senator Tammy Baldwin, but a national report by the RAND Corp found more than half of the public health officials across the country feel unprepared to launch this new line because of a lack of financing or staffing for the infrastructure.
It does require a commitment, continuing commitment on the part of states and the federal government to make sure that as the volume of calls go up, and we're able to help more people, that the resources are there.
Caroline Crehan Newman heads up Wisconsin's transition to 988 at the state's Department of Health Services. She says the state has pieced together funding through a mix of state and federal grants, including COVID relief funds. But there is some concern for staffing if more calls start coming in.
Depending on how big the jump and the increase is, people may need to wait.
What is the concern if people are put on hold?
I think the concern is that people will hang up. I think a lot of people who are experiencing emotional distress.
And that could mean lives lost. Data from Children's Wisconsin shows 29% of young adults have a mental health illness. 16% of teens have contemplated suicide, and 7 have attempted it.
This is crucial that it be adequately staffed and that the resources are there for referral at a moment of crisis.
Currently, DHS tells me people in Wisconsin wait on average 60 seconds before they're connected to someone. Wisconsin ranks around the top 5 in the country in state answer rates, which means someone in the state picks up the call. They do that about 90% of the time. The rest go to a national line. The ultimate goal when this nationwide line rolls out is to make sure everyone gets the help they need quickly.
When you call 988, that counselor is going to be able to refer you to a therapist right there down the street from you. So we know that being connected to local resources and to our local communities is really important.
Again, this 3-digit suicide and mental health crisis lifeline does not go live until July 16th. If you need help right now, dial 1-800-273-TALK. We'll also have that number online at tmj4.com in this story. Reporting downtown, Rebecca Clough, TMJ4 News.